To that breaking news Tom was mentioning at the top of the half hour, we are learning some breaking news out of Gallatin about a nursing home that's having to be evacuated. That presser is happening right now. Let's listen in.
Susan Peach, P-E-A-C-H, and Gallatin Mayor Paige Brown, B-R-O-W-N. At the conclusion of their speaking, we'll have a brief question and answer session. Chief Miller.
Good evening. Shortly after 6 p.m., the Unified Command Post in Sumner County was notified by the State Emergency Operations Center in Nashville that there were a large number of patients at the Gallatin Center for Rehabilitation that needed to be transported. At that point in time, we contacted Brandon Ward, the State of Tennessee EMS Director, as well as our regional consultant, Dwight Davis, and coordinated some mutual aid with some neighboring counties. So Sumner County EMS provided 5 ambulances. Cheatham County EMS provided 3 ambulances. First Call Ambulance Service provided 5 ambulances. Medic 1 Ambulance Service provided 4 ambulances, and Dixon County Emergency Medical Service sent 1 ambulance. Thus far, we are scheduled to transport a total of 19 patients out of this facility. We're told that that number could increase, but right now that is the number that they have advised us. We were advised that some of those patients had tested positive for COVID-19, and the other ones were being transported out of an abundance of precaution because they were displaying signs and symptoms and were awaiting official test results. All patients thus far, and the ones that we have still yet to transport, will be transported to Sumner Regional Medical Center here in Gallatin, Tennessee. And at this time, I will ask the CEO of Sumner Regional Medical Center, Ms. Susan Peach, if she would come up.
Thank you, Chief Miller. Well, good evening, ladies and gentlemen. I'm Susan Peach, and I'm the CEO of Sumner Regional Medical Center. We can confirm, as Chief Miller said, that the High Point Health System is accepting patients from the Gallatin Center for Rehabilitation and Healing. We are receiving 19 patients that we will triage and admit using our routine admission criteria. We have mobilized our emergency team, and we are already implementing plans that will immediately and significantly increase our capacity across our health system should we experience a steep increase in critically ill patients. Our hospital in Gallatin, Sumner Regional Medical Center, has been treating patients for COVID-19, and our critical care team has been at work preparing additional isolation units. Our facilities in Carthage and Hartsville are also ready to accept patients as extended or step-down care treatment centers for those senior patients who will be discharged but may not be able to return to a nursing home facility. We are working closely with our partners at the Sumner County Health Department, the Tennessee Department of Health, Mayor Brown, and Governor Lee to ensure that we have a well-coordinated effort to provide care to every patient who needs us. In times like this, we act as one team, wholly committed to the health and safety of every member of our community. Our team is prepared. The work they do every day on behalf of our patients and our community is truly heroic. Now more than ever, I'm very proud to work alongside of them. I want to stress to all of you how important it is to stay home and stay safe. Thank you.
Good evening. Thank you to Chief Miller and Ms. Peach. While this is an incredibly sad time for our community, we know a lot of people are suffering. I am immensely proud of the swift and swift actions of our partner agencies. We've had the state of Tennessee, Governor Lee, our state senator Farrell Hale, certainly Sumner Regional Medical Center, our local Sumner County Health Department, our emergency management agency, our emergency medical services, and as Chief Miller mentioned, several other counties have helped us with transport this evening, and First Call Ambulance has as well. We ask that you keep these patients and their families in your prayers. And we ask that this serve as a message to you all that this virus is so very serious. This spread within one facility is indicative of the seriousness of this virus and how much it can spread in a very short period of time. I do have so much faith in our local medical center and the swift response that was provided by our coordination and agencies this evening. We will continue to work together to address the situation. We apologize for the short notice this evening. As you know, there are teams reacting as we are here at this moment, but we knew that you were anxious to get information, and I wanted you all to know that we are committed to providing that as soon as we are able to. So bear with us as we continue to navigate this over the coming days, and we will continue to keep you updated, and we certainly are open to answering any questions that we may be able to at this time. So I would welcome the rest of the folks forward at this time and open the floor for your questions.
Do we have a split in terms of who was a resident and who was a staff member that tested positive? A breakdown of that?
At this point, we are receiving the patients from the healthcare facility, and we are dealing with the public health department on those staff members that have been tested. The public health department has that information.
Can you talk a little bit about the condition of the patients that you do have right now, and at what stage they are in the virus?
Well, actually, no, I can't, because they are being triaged right now. I have a team of expert physicians that are trained and board certified in emergency medicine and very, very experienced nurses and respiratory therapists that are assessing every single patient. And they will all be assessed just like every other ER patient is. And they will be either admitted to the critical care special isolation unit that we have designed, where the team of medical providers will pay special attention to them and watch them extremely carefully. And those patients that are more stable will be admitted to the secondary isolation unit that we have created.
Any idea how this spread? Yesterday, the nursing home told us it was only one resident that tested positive for COVID-19, and now we're talking about 19 people being transported.
Well, as you know, I'm not an expert in this disease, but the evolution of the disease takes days, and it affects every person differently. So we are responding as we were called, that there was a need to accept patients out of abundance of caution to make sure that they were in a place where they could be very carefully watched. So we stand to serve the nursing home and to protect our community by accepting as many patients as possible and watching them closely.
I think a lot of folks were scared this was going to happen in nursing homes after what happened in Washington State. That was the big one that a lot of people watched. What do you say to folks who have their parents or grandparents in a home, and just any reassurance for them about this? Because this is scary.
You're right, it is scary. And my advice for family members is to maintain contact with the nursing home. I am sure almost all of our nursing homes are carefully watching their patients, as all of us in healthcare are carefully watching our patients and our employees. We have limited visitors to no visitors at this point, and we are encouraging, just like the governor said, for everyone to be aware that they could come in contact with this virus and they could catch it. So I think all of us as healthcare providers need to treat each and every individual as a potential COVID patient. And that's what we're doing at Sumner Regional.
At this point, is the plan just to transport the ones that are showing symptoms, or is there a plan at this point to evacuate everyone from that facility?
I don't have any more information on the level of detail. We are just available to any patient that facility or the state feels needs a higher level of care, and we remain ready to treat them.
Go ahead.
Talk about how important it is for the employees themselves to be aware of how they themselves are feeling, because, yeah, you're looking at the patients, but this came in on staff too.
Absolutely. I have been working with my staff diligently, 16 to 18 to 20 hours every day for the past few weeks, to guide them on the use of PPE and the protective equipment that is necessary to protect them. We are logging each and every employee that comes in to make sure that they don't have a temperature and that they don't have any signs and symptoms. And we are providing additional support for those employees should they need it.
Are the staff that possibly were maybe in contact with these patients that developed the virus, are they in quarantine now, or are you all still figuring that out?
Sorry, would you repeat that?
I was just saying the staff that was interacting with these patients, are they in quarantine right now, those staff that might have specifically been working with the patients that developed this virus?
I don't know how they are dealing with the staff at the nursing home, so someone else may want to speak to that.
Do you have an age range for these patients?
They're all elderly. That's all I know.
And going back to what you said, you were evaluating the patients who came in. So are you saying that no one has told you prior to them coming to Sumner Regional what their status is?
The only thing we know about these patients is that they have been evaluated at the nursing home, and it has been decided that they need a higher level of care. But just like any patient that presents to our hospital, we will evaluate them with a team that is on site, and then disposition at that point is decided by those healthcare workers at that point.
To give folks kind of a timeline, when were you all first informed or warned that there might be a case here?
I, as the mayor of this city, became aware of concerns regarding the facility on Wednesday. And since that time, the agencies that I mentioned earlier have all been coordinating efforts and communicating with the facility here in town, and they have been cooperating. Support has been going to them, and certainly lots of communication. And then today, I think all of the orders came down from the state that made it possible to begin transporting patients.
What time did emergency workers start flooding the nursing home?
I believe he began transporting at 8:20 this evening. I think 8:20 was the first transport of 9 patients at that time, and so that transport is still going on.
What goes along in that process? Is there going to be some sort of deep cleaning, or what work do they have to do throughout the night? I don't know if anybody knows that.
Yeah, I think that would be nursing home specific.
You talking about the EMS deep cleaning, or are you talking about the nursing home?
The EMS, I would say
Okay.
first.
Again, we tried to take an abundance of precaution, so we limited the attendants in the back of the ambulance, and they had all of the layers of personal protective equipment on. And then we had a separate person up front that would be operating the ambulance that would not have patient control or patient care contact. That way we wouldn't cross-contaminate the patient department.
So you've been listening to a live news conference where
we've been
really our
doing
News
ever
Force
since
Cameron
we
Taylor has
launched
been asking the majority of the questions there, but this is coming out of Gallatin. We learned last night that the Gallatin Center for Rehabilitation, so essentially a nursing home, already did have one confirmed case of COVID-19, but we learned tonight as breaking news just before we came on the air that there were many, many more that were needing to be evacuated from the facility. Now, if you've just joined us, earlier in this news conference, which has been going on for about 15 minutes now, we learned that 19 people total were transported from that nursing home to Sumner Regional Medical Center in 18 different ambulances. Now, they did say that not all 19 have tested positive for the virus at this point. We know some of them have, but then others are already exhibiting symptoms of the virus, so they are being taken as well. We're going to take a quick break. When we come back, we'll, of course, look at this again, continue to develop the breaking news here, and give you more information as we deal with COVID-19 here in Tennessee.